Let's just take you live to Sydney's west and southwest. New South Wales Premier Dominic Perrottet, also the Minister for Sport, are out there. There has been an announcement, but Dominic Perrottet has also been taking questions about allegations of branch stacking to do with his brother. Let's have a listen in.
Is look after your customers. CBA has an obligation to stand with their customers at a difficult time. The banks are very fast to raise rates, but very slow to reduce them. We've gone through a very difficult few years, particularly during the pandemic, and our government has stood side by side with households and families right across New South Wales. At a time when we could have cut back because our budget is under pressure, we have over $7 billion in cost of living support measures to help families get through. It's exactly what we did at the pandemic during the housing challenges that we faced then. There are 30,000 less people on the waiting queue today than there was when Labor were in government, and that's obviously with a much more increased population. So where we can do more, we will. But I'd say to the CBA today, they should follow exactly what NAB has done, and I welcome the moves by NAB to say today that they won't be increasing rates. They'll increase rates at the same time, at the same rate as they reduce rates for lenders, and that's so for borrowers, and that's incredibly important. At the same time, I make this point very clear, and NAB has come out and said they will do this, and I thank them for that. For savers, and particularly elderly people across New South Wales, if you're going to jack the rates up on borrowers, you should make sure that savers are also passed on that interest rate increase as well. This is a time for banks to stand with their customers when households across New South Wales are doing it incredibly tough. I welcome what the NAB's done, and I call on other banks to do the same.
Premier, the social housing wait list has blown out massively since 2022. There's almost 58,000 people waiting on the waiting list right now. What will you do?
Well, firstly, I'll make the point, as I just did, that there are 30,000 less people on the waiting list than there were under Labor. Now, I don't want anyone on the waiting list, and that's why we are building more homes. That's why we are building through the Accelerated Infrastructure Fund more infrastructure to support that. And we need to do everything we can. It's a difficult economic time. There are going to be challenges through it. And we're not just dealing with the short-term challenges, we're also making sure we build a brighter future for everybody across our state. And you can't do that without a long-term economic plan. That's exactly what the Liberals and Nationals have.
On healthcare, the HSU has been called on a special commission inquiry. Chris Minns is now confirmed support. Is it necessary? Do you need something like that?
I've been speaking to Dan Andrews about this today. We are completely on the same page. These matters will be worked through the National Cabinet. This is what we need are more bulk. What we need are more bulk billing GPs, not more lawyers and their fees. That's what you get in a 2-year Royal Commission. Now, we've discussed this amongst premiers, and I say this from a position of strength here in New South Wales because we have the strongest health system in the country. We don't have the ramping issues we see in other states. During the pandemic, 77% of people coming into our emergency departments were seen on time. That's compared to 67% across the country. Wait times less in New South Wales. We need better integration between the primary care network and the public health system. But ultimately, the number one issue that we can do here is ensure that there are more GPs in communities right across New South Wales and right across the country, and more bulk billing GPs as well. And the Commonwealth Government needs to step up through National Cabinet to deliver that. The time for talk is over. We've had a 1 in 100 year pandemic. If we can't reform the health system now, we never will. It needs to be done in an appropriate way with all premiers working together, and that is our focus. Now, what I would say to Chris Minns is don't play politics with patients. What we are doing, all premiers across the country and chief ministers, working through the National Cabinet process to deal with these issues now. We know what the solution is. It's more GPs. It's more bulk billing GPs in every community across New South Wales.